Do short theme song intro. Hello, welcome to Left of the Box. Bonjour, bienvenue. I'm Sandy. It's been a crazy summer. We finally had a week with some good news in it, like Alex Jones being caught in his lies and Trump's Mar-a-Lago being raided. Good American news, distracting us from the complete S show that's happening up here. Ontario had an election. Given the turnout, I wouldn't be surprised if some people have already forgotten. But this election was so unbelievably important, and for the next 4 years, it will be hell trying to prevent the Ford government from completely destroying this province. In this video, I'm going to go over what the Ford government means for our healthcare. There's a couple of buttons. I'd like you to push them. Please share this video far and wide. If you're on Twitter, so am I. I know times are tough, so if you can, please help support my channel by becoming a patron or purchasing something off of my wish list to help build my studio. Links in the description box below. I'll start with a quick rundown of how bad this election was. It set a record for the lowest turnout ever, with only 43% of eligible voters turning out. The Ford government won less than half the votes cast, but ended up gaining seats to secure a stronger majority. Our first past the post system for elections is bonkers. But here's the thing. Since turnout was so low, when taking into account all the people who didn't vote, Ford won with just 18% of possible votes. I can't tell you how incredibly angry this makes me. 26 people died of dehydration in long-term care homes at the beginning of COVID. People living and dying in revolting conditions. He's responsible for their torturous deaths. His buddies who sit on the boards of these homes and profited from it are responsible. And instead of being held accountable, they were rewarded with 4 more years. 4 more years of cutting services to long-term care homes. 4 more years of suffering. 4 more years many people don't have. So many people died who didn't need to. So many people will die because of the policies put in place by Ford and his goons. We had a real chance this election to increase the rates for people relying on ODSP to a level that would allow us to pay for rent and groceries. Instead, we may only get a $50 increase. The cost of living has skyrocketed. $50 won't help prevent people with disabilities from being kicked onto the streets, from not being able to get the things they need in order to survive. It won't prevent people with disabilities from choosing MAID to end their suffering. I know people say you shouldn't shame people who chose not to vote because they didn't have faith in any of our political parties. I don't care. We are about to have an unprecedented level of privatization in our healthcare. Part of the Greenbelt will be destroyed. Education will continue to be cut. Hundreds of millions will be funneled to his wealthy buddies. People around me are going to suffer, and some will not make it the next 4 years. Don't give me excuses as to why people didn't vote. If they couldn't do it for themselves, they should have done it for the sake of the most vulnerable people in this province. I don't have 100% faith in any of the political parties. There are major issues with all of them, but some of them are far worse than others. I'm glad Andrea Horwath stepped down as NDP leader. She should have a long time ago. If the next leader doesn't reflect the social values of the base, then the Ontario NDP is defunct as a party and nothing more than an extension of the neoliberal party. I get people are fed up with politics. It feels like nothing ever changes, but unplugging from the problem doesn't help. People need to get involved now. We need to fight like hell if we're going to keep our healthcare public. Okay, so what do I mean about keeping our healthcare public? It's currently in free fall, and that was the intention. From CBC News, Ontario paramedics say ambulance response times are slower due to growing offload delays. So people who call for an ambulance in Ontario may have to wait longer for one to arrive, as healthcare staffing shortages and recent temporary emergency room closures slowed down emergency services response, a paramedics group says Friday. Ambulance offload delays. When paramedics wait in an emergency department for a patient to be transferred to the care of the hospital, are tying up paramedics for longer and longer, preventing them from responding to calls during that time. We are living in a time where if you call an ambulance, one might not be available for a long time, which means every minute that ticks by, there's more chance the person who needs it will die. Really, the only way around it, don't have a medical emergency. Titanic staffing crisis leaving at least 14 Ontario hospital units shut down ahead of long weekend. The intensive care unit at a hospital in Bowmanville will be temporarily closed amid a significant staffing shortage alongside more than a dozen other hospitals that are expecting to reduce beds and relocate care ahead of the long weekend. The hospital said, "We recognize the impact of this temporary relocation on patients and their families. The decision was not made lightly." So if you can get an ambulance when you need one, there might not be anywhere nearby they can take you. And why is this happening? Apparently nurses with decades of experience are choosing to change jobs to like Boston Pizza or Costco because they are under an unbelievable amount of stress. These past couple of years has been traumatizing for anyone in the medical field. And nurses aren't paid well. They aren't compensated for what they've been going through. And just to add salt onto the wound, the Ford government put in place Bill 124, which actually caps their yearly increases that they are allowed on their salaries to 1%. The Ford government has been purposely underfunding the healthcare system so that this would happen, so that it will collapse. And here's CBC again. Ontario isn't ruling out privatization in healthcare. Here's what it could look like. And more from CBC on how they covered this. CBC's Radio's The House. Does Canada need more private healthcare? No. The answer is no. Hell no. Fuck no. Whatever you want to say, no. What a lot of people don't realize is a lot of our healthcare has already been privatized. Our long-term care homes, a lot of that has already been privatized. This hasn't made things better. It's made it worse. The tragedies that happened in long-term care homes was due to the cuts, the understaffing, the underfunding, the privatization, the profits over people model. And they want to bring that to Ontario healthcare. They made the problem by underfunding it. They chose this direction. Both the Conservatives and Liberals did this. And now that the healthcare is about to collapse and is in shambles, now they're pitching, oh, let's privatize it to make things better. That's not how it works. It will make it worse. What we need to do is properly fund and expand Ontario's public health care. That's the only way it will best serve all of the people in Ontario. And there are many more articles talking about the staffing shortages, nurses leaving their jobs, hospitals closing emergency rooms, ambulance not being available, and services not being provided. This isn't something that just happened. The pathetic excuse of Canadian media made the choice not to report on this before the election. Ford's team has been saying this out loud for months.
We're opening up pediatric surgeries, cancer screenings, making sure that we can let independent health facilities operate, private hospitals. All of those things are possible because we do have the capacity that the Premier mentioned.
Wait, did you hear that?
Making sure that we can let independent health facilities operate, private hospitals, private hospitals, private hospitals.
That was Health Minister Christine Elliott 7 months ago. And there is almost no other mention of what she said in any other media article. This wasn't just the Conservatives doing. It started with Mike Harris, one of the shareholders of long-term care homes responsible for the preventable deaths of people and who's been rewarded by Ford. The Liberals were in power for 15 years before Ford got in. They are also responsible for privatizing part of our healthcare and long-term care homes. They did nothing to repair the damage Mike caused. Ford would not be able to dismantle what we have so easily if it weren't for the Liberals stripping it down to the foundation. What we need to keep in mind is once Ontario sets the precedent for privatization of healthcare, the other provinces led by Conservatives will follow suit, and the federal Conservatives will solidify it across the country the next time they're in power. Ford is willing to let the people of this province die if it means more profit for him and his buddies. It's already been happening, and since there's been no accountability, it's only going to get worse. We need to get ready to fight back now. Protest. Contact your MPP. Look into the Ontario Health Coalition. I've linked them below. They're a great resource for actions that are happening. Everyone needs health care. It shouldn't be a privilege. It's a right, and we need to fight for it. I don't want to leave this on such a downer. And luckily, There was also some good news to happen here in Ontario as well.
Darn right we have to improve it. There's always solutions that we have to move forward, but not coming from the government per se, but holy Christ! I just swallowed a bee. Holy Christ! I knew that little bugger. Oh.
I feel no guilt for laughing at this every time I see it. The only thing I have sympathy for is the bee. That bee sacrificed itself to bring attention to Ford talking about health care and is now the symbol of the resistance. We all need to be the resistance. R.I.P. little guy. If you could be so kind, please hit the like and subscribe button. You'd be as sweet as honey if you follow me on Twitter. You will give me hives if you become a patron. Sting me by getting me something off my wish list to help build my studio. A special thanks to all the queen bees who've already signed up. Salut, à la prochaine. Thank you for watching and stay tuned. I'm Sandy, wishing your tomorrow is better than your today.